Some of the state's top health officials testifying before state lawmakers today on the deadly COVID-19 outbreak at the Holyoke Soldiers Home.
The joint legislative session looking to get to the bottom of staffing levels at that facility where more than 75 veterans died after they tested positive for COVID-19. Western Mass News reporter Audrey Russo joins us now live in Holyoke with more. Audrey.
The legislators not only discussed some changes that were made to how the facility staff is managed, but also some of the requirements that one must have in order to be considered a candidate for superintendent.
You're not giving staff certainty on their schedules. If people were not knowing what their schedule is going to be.
State Health and Human Services Secretary Mary Lou Sutters fielding questions from legislators on why staff turnover rates were so high at the Holyoke Soldiers Home. Members of a joint legislative committee are tasked with investigating the deadly COVID-19 outbreak at the facility. Thursday, they were eager to address the staffing shortages and other problems that caused the pandemic to spiral out of control.
There was not the internal processes, clinical, management, and operations to withstand a pandemic. There are many nursing homes in Massachusetts that faced the pandemic, including Chelsea, but their internal structures didn't collapse.
The lawmakers questioned Sutters as to why being a licensed nursing home administrator is preferred, but not a requirement of a potential superintendent. That is a requirement at private facilities across the state. Sutters says the distinction isn't rigorous enough when it comes to actual health care experience. She believes even a licensed nursing home administrator couldn't have reined in the pandemic, given the home's operational failings.
I don't think one person would have been able to have stopped that.
One of the committee members, State Senator John Vilas, says the goal of their questions is finding solutions.
We need to really transition to the going forward part of this.
Vilas says after speaking with families, his concerns about staffing are linked to the home's ability to facilitate resident visits once again.
You've got all these veteran residents not able to speak to their families, talk to their families in a very meaningful way, I would say. So I'm concerned about that impact.
Others who testified today include the current Department of Veterans Services Secretary Cheryl Poppy, Board of Trustees members, and other personnel from the Soldiers Home. Now, the Legislative Committee's report is due in March, and that's roughly 1 year after the pandemic had its outbreak inside the Soldiers Home. Live in Holyoke, Audrey Russo for Western Mass News.